Okay, so we're just going to run through The Age of Treason. 1958 book exposes the nefarious plans by our so-called leaders. This is the article by Daniel Taylor. Now it's The Age of Treason, which was written 1923, and then The Age of Sanity was written in 1958. So this is a brief synopsis of the 1923 edition and a little bit about Dr Swinbure Clymer as well. This is by Daniel Taylor from Oldtimer News. Dr. R. Swinbure Clymer was in many ways a man ahead of his time, and most certainly controversial. He was attacked by the medical establishment for connecting diet with disease and mental health in his 1917 book, Dietetics. I actually have that book. Well, I had it up until about 5 years ago, but it was one of those books that I never read, but had intended to. Dr. Clymer received his medical degree in 1902 from the College of Medicine and Surgery in Chicago and began practicing osteopathy. Accusations of fraud surround Dr. Clymer's career, including this 1923 edition of the Journal of the American Medical Association, which claims that our records fail to show that this man ever regularly graduated by any reputable medical college. What Clymer had to say more than likely had something to do with the denouncement that he received from the medical establishment. Though Dr. Clymer may be surrounded with controversy, his 1958 book, Your Health and Sanity in the Age of Treason, exposes toxic food additives and fluoride with documentation, the majority of which are mainstream scientific studies that can be verified many times over. What makes this book unique is the fact that Dr. Clymer was one of the first to point out that statements by the elite indicated that these toxins were to be deliberately released for the mental deterioration and moral debasement of the mass. The book is appropriately subtitled Food and Liquids Used as a Medium in Deliberately and Carefully Planned Methods Developed by the Vicious Element of Humanity for the Mental Deterioration and Moral Debasement of the Mass as a means towards their enslavement. Dr. Clymer introduces readers with a stark warning for the future, writing, "Imagine yourself, if you can, becoming conscious that you are gradually losing your manhood, that your mind is rapidly deteriorating, so that you are no longer capable of thinking clearly, unable to plan your future actions. Your resistance is becoming so weakened that you are no longer master of yourself. In short, you are rapidly developing into a moron, a robot, a zombie, readily subject to the dictates of others." Bertrand Russell's 1953 book, The Impact of Science on Society, is cited by Clymer as one example of the elite's desire to dominate the masses. Russell stated that under scientific tyranny, diet, injections and injunctions will combine from a very early age to produce the sort of character and the sort of beliefs that the authorities consider desirable, and any serious criticism of the powers that be will become psychologically impossible. Dithylstilbestrol, endocrine disruption. Dr. Clymer identified the synthetic estrogen dithylstilbestrol, developed in 1938 as a means to achieve the aims of the elite. Clymer explains that some of the toxic additives discussed in the book may not have been employed for the express purpose outlined by the elite, but they served their purpose admirably. Dr. Clymer elaborates, the employment of stilbestrol by the laity, with obviously no knowledge of the dangerous agent they are employing in conditioning chickens and meats, is mass medication without license, with a dangerous toxic drug that may have universal disastrous results on all who eat such adulterated foods. This is especially true as it concerns children, youths, young women and men, resulting as it may in their sterilization or cancer, something fervently hoped for by the enemies of mankind. Because stilbestrol is a synthetic chemical, the natural protective activity of the bodily organs are ineffective in prohibiting harmful results. Natural estrogen, on the other hand, is decomposed, and any of its possible harmful effects may be more or less made ineffective. Writes Dr. Clymer, stilbestrol was used as a treatment for various types of cancer and menopausal symptoms, but, as Dr. Clymer states, physicians versed in the use of endocrines agree generally that stilbestrol is a dangerous drug in all except experienced hands. Dr. E. Malcolm Stokes, in an article published in the Western Journal of Surgery, Obstetrics and Gynecology, September 1948, wrote, "Single last doses of natural estrogen substances are quickly excreted. Long continued repeated administration in relatively small doses, as in daily consumption of meats permeated with stilbestrol, may intensify tissue response to the hormone." Dr. Clymer warns that such chemicals are to feminize men. Every vigilant human being should be concerned with several important factors involved, the methods or means by which it is possible to change man's characteristics as easily as the animals. Man is a warrior by nature, the protector of his family and his own rights and privileges, as an individual, a free man, a being who has wrought great things, and who, if not interfered with, will do even greater things. This being so, this being is to be turned into a lesser female, unable, even unwilling, to defend himself, much less his family or country, becoming a slave. Dr. Clymer's concerns over stilbestrol have been vindicated over time, as the chemical has been phased out of use as a growth hormone in the late 1970s due to concerns over cancer. Additionally, in 1971, the FDA advised physicians to stop prescribing stilbestrol to pregnant women due to high cancer risk. The drug is no longer being manufactured as of 1997. Flash forward. Bisphenol A. Today there are continuing concerns as substantial levels of bisphenol A, BPA, have been found in a large percentage of the Western world's population. Like dithylstilbestrol, BPA is a synthetic estrogen with similar to identical effects on the human body. BPA is perhaps a much larger threat due to the fact that, unlike stilbestrol, which was primarily consumed in meats, it is found in many household products, including the food we eat. A recent study from the Canadian Health Measures Survey found that over 90% of Canadians have detectable concentrations of BPA in their urine. Studies conducted by the CDC found bisphenol A in the urine of 95% of adults sampled in 1988 through to 1994, and in 93% of children and adults tested in 2003 to 2004. Other studies have shown that bisphenol A causes feminization of males and reduced sperm count. As Dr. Friedrich von Saal states in his local Fox News report, levels of BPA below a trillionth of a gram have been found to alter cell function and growth. Additionally, BPA was found to feed cancer cell growth and impact the reproductive system of rats. Fluoride. Yet another danger to human health and well-being identified by Dr. Clymer is sodium fluoride. Fluoride, we are told, is placed in the water supply to help protect our teeth from decay. Today, some are proposing that fluoride and other forms of mass medication will serve as a means of cognitive enhancement. In his expose of fluoride, Dr. Clymer quotes Renee M. Vale, a former communist and party worker, in her book Red Court, published in 1952. She writes, "In regions of the country where resistance was most apt to develop, we saw to it that virus diseases struck, and when antibiotics threatened our program, we devised other means of violating the populace. Fluoridation of drinking water was found to be about the most successful." Dr. Charles E. Perkins, who Dr. R. Swinbure Clymer was in personal contact with, was sent by the United States government to help take charge of the IG Farben chemical plants in Germany at the end of the Second World War. What follows are quotations from a letter which Mr. Perkins wrote to Lee Foundation for Nutritional Research, Milwaukee, Wisconsin, dated October 2, 1954. Mr. Perkins' letter states, "The German chemist worked out a very ingenious and far-reaching plan of mass control, which was submitted to and adopted by the German General Staff. This plan was to control the population in any given area through mass medication by drinking water supplies. By this method, they could control the population of whole areas, reduce population by water medication that would produce sterility in women, and so on. In this scheme of mass control, sodium fluoride occupied a prominent place." We are told by the ideologists who are advocating the fluorination of water supplies in this country that their purpose is to reduce the incidence of tooth decay in children, and it is the plausibility of this excuse, plus the prominence of those who are responsible for the present spread of artificial water fluoridation in this country. However, and I want to make this very definite and very positive, the real reason behind fluorination is not to benefit children's teeth. If this were the real reason, there are many ways in which it could be done that are much easier, cheaper, and far more effective. The real purpose behind water fluoridation is to reduce the resistance of the mass to domination and control and loss of liberty. I was told of this entire scheme by a German chemist who was an official of the great Farben chemical industries and was also prominent in the Nazi movement at the time. Dr. Clymer additionally cites a 1956 letter written by the then New York Water Commissioner Arthur C. Ford. In the letter, Ford speaks out openly against fluorides as extremely toxic substances. Ford writes, "We are aware that the fluorides are extremely toxic substances, and evidence exists to show that even at the recommended level of 1 part per million of fluoride in drinking water, people in fluoridated communities have been harmed. We know of reputable independent medical authorities throughout the United States and in the local area who have found evidence of fluoride damage to persons living in fluoridated communities. These medical authorities disagree with the fluoride hypothesis, and they have raised grave questions with respect to the safety of the procedure for an entire population, which includes the young, the old, the susceptible, and the infirm, as well as the healthy. Fluoride, besides being a toxic substance, is not all excreted when taken into the system, a significant percentage remaining cumulatively. Fluoridation of the drinking water at any level of concentration is a very indiscriminate procedure, since children drink widely varying amounts of water. Australian television recently reported on fluoride's harmful impact on human health and efforts to expand water fluoridation on the continent. As sperm counts continue to fall worldwide and GMO crops escape into the environment, exposure to untold numbers of environmental toxins like BPA is a continuing threat. In the United States, several EPA scientists have denounced fluoridation, calling for a national moratorium on the fluoridation of water supplies. Citizens in Wichita, Kansas are becoming active in raising awareness of fluoride, drawing attacks from the local media. Awareness of these issues is essential not just for those living today, but for future generations. Open admissions of the intent to chemically alter humanity should leave us with nothing but a sense of duty to warn others of the grave threat we face. And I think I don't really need to say any more on that, because now we're looking at synthetic foods. We're already being bombarded with chemicals in almost everything that we touch. They're also now going to be altering the genes of our food, to the point where they are creating things that are not known on Earth. Who's to be held accountable? And frankly, where's the jurisdiction? Because we never ever get told or asked, is this something that we want? And I don't understand why we have to be living in an environment where the leaders, the so-called leaders, seem to be so anti-nature. When you look back into ancient cultures, you can see that they very much worked with culture to the point where they don't understand the slash and burn culture of South American Mexicans to this day, because according to them, no one should have been living on that land because it's not fertile, but millions of people were living there because of the way that they were farming and the way they were able to provide food for everybody.
And I was looking for some disinfectant spray, and I ran across this Lysol right here, and it kills illnesses that causes germs and many other diseases and things that's surfacing that can cause infections or anything like that. So I grabbed this one specifically. It kills 99.9% of all viruses and bacteria. So I went on the back of it. Let me show you guys. So I went on the back of it. I'm going to zoom in for you guys. And I see this. The human coronavirus. Like, how odd is that? Like, they've been knowing about this virus more. And I was looking for some disinfectant spray. And I ran across this Lysol right here. And it kills illnesses that causes germs and many other diseases and things that's surfacing that can cause infections or anything like that. So I grabbed this one specifically. It kills 99.9% of all viruses and bacteria. So I went on the back of it. Let me show you guys. So I went on the back of it. I'm gonna zoom in for you guys, and I see this, the human coronavirus. Like, how odd is that? Like, they've been knowing about this virus for years, and they saying they don't have a cure. And look what it says on top, on the back of this Lysol spray, human coronavirus. Please share this video. This is crazy.
There are strange facts surrounding the coronavirus outbreak of 2020. In 2018, the Purebright Institute was granted a patent for the coronavirus. The Purebright Institute is funded by the Bill and Melinda Gates Foundation. On October 18th of 2019, the Bill and Melinda Gates Foundation, along with Johns Hopkins and the World Economic Forum, hosted Event 201, a high-level pandemic simulation in New York City. The simulation, which was held just 3 months ago, was based on the coronavirus. They concluded that it could kill 65 million people and decided the solution was to have a vaccine within months of an epidemic. The same week that the coronavirus makes headlines, Netflix releases the docu-series Pandemic: How to Prevent an Outbreak, wherein the solution is vaccines and the trusted hero is Bill Gates. Meanwhile, the Bill and Melinda Gates Foundation fund Innovio Pharmaceuticals, Inc. to develop a coronavirus vaccine. It's weird, right? Or am I just a conspiracy theorist? What about this? 5G, an emerging technology upgrade that has many countries concerned about its impact on human health. Experts from all over the world warn of the dangers of 5G. In 2018, it was reported locally that Wuhan would be the testbed city for full 5G network operation in China. The article went on to say that it would be fully operational by 2020. And on Halloween of 2019, they turned it on. Scientists warn that 5G causes flu-like symptoms. Interesting? What is also interesting is that when trying to share the link of 5G being launched in Wuhan, Facebook blocks you from doing so.